Hello and welcome. We see a bunch of people joining us. Thank you for coming today to listen to the third of our three-part series on balance. If you can, oh, there's Bill. Please introduce yourself if you'd like to, and let us know where you're calling in from in the chat. We love to see where we're having people join us from. Hi, William from West Virginia. Welcome. Thank you for joining us today. Minnesota, North Carolina. Pat from Texas, welcome. Virginia, Connecticut. Leah from New Jersey. Bob from Washington. Some more from Virginia Beach, Washington, New York. This is great. Katie from Boston. Welcome, Lisa. Idaho. This is great. We're getting wonderful representation from everywhere in the US. It's great to have you all here. Thank you for joining us. As I mentioned before, we're going to be talking about balance and the treatment of balance in Parkinson's today. Fort Worth, Texas, California, Idaho. Wonderful. As you join us, and you can enter where you're calling from and your name in the chat if you'd like to. Also keep in mind we have the Q&A. So if you're coming to the presentation with any questions about balance and the treatment of balance, you can go ahead and pop those into the Q&A. And we have a nice amount of time at the end of the PowerPoint presentation to answer those questions. Great. Hi, Steve from California. And in Ohio, I think that's our first Ohio. Great. Wow, thank you everyone for joining us. This is great to be here. And we are also live on Facebook. So I'm going to begin the presentation. So again, I had mentioned for some of you who joined us a few minutes ago, but this is the third of a three-part series on balance and part of our Let's Keep Moving series that we started back in April. So the Let's Keep Moving Balance series was in July, and Tim Nordahl started us off with discussion of balance and the impact of Parkinson's. And then Teresa Baker, when in August, presented in the second part of the series, a presentation about the assessment of balance and what types of things a physical therapist would look for when assessing balance with Parkinson's. And then finally today, I'll be talking about evidence-based treatment of balance with Parkinson's. So again, I'm happy you could all join us. We do have a Q&A at the end, so if you have questions as we go along, please answer them in the Q&A. We do try to get as many answered as possible live. We try to pick ones that will apply to the most number of people. If you have a question that does not get answered, I have information at the end of the presentation about how to reach out to us and we can answer your specific question directly. All right. So it was a little more of an intro. My name's Tamara DeAngelis. I'm a physical therapist at the Center for Neuro Rehab at Boston University at Sargent College. And we are a center at BU that does research and clinical care for people with Parkinson's. We also are lucky enough to house, with the support of the APDA, a Rehab Resource Center. And again, I'll give some more information about how to reach us there, but our Resource Center provides educational resources and a helpline to people with Parkinson's, their care partners, and also healthcare providers. So before I get into the details of treatment, I want to revisit why it's so important to talk about balance in Parkinson's. People with decreased balance are more likely to fall. 68% of people with Parkinson's disease report a fall in a year. People with Parkinson's disease have a higher fall rate than other older adults. And probably most importantly, falls are a contributor to disability, injury, and decreased quality of life. So one of the goals with treatment is to delay the onset of falling and improve balance to prevent falls. We're going to talk about different ways to do that. So when we talk about balance, we want to know, what is balance? How do we define balance? So balance is the control of the body's center of mass over its base of support in order to achieve equilibrium and orientation. So basically, being able to be steady and stay upright. So it's this complex. A lot of systems are involved in order to achieve this equilibrium and orientation. And our brain is processing a lot of information in order to do this. And it's processing information from our nervous system, and this visual input, our inner ear or our vestibular system, even sensation from our feet, and then also our musculoskeletal system. So muscles, joints. And it's also trying to do all of this while we're both standing and moving around. So what does this complexity mean for treatment? Well, it's actually good, because all these different systems that are involved in balance give us a lot of opportunities of different areas to target when we're trying to treat balance. So before I start talking about the treatments, I just want to present the framework that we use to kind of discuss all these different systems in balance. The words have been modified here, but the framework originally was created by Faye Horak, and Teresa, in her presentation on the assessment of balance, went into quite a bit of detail on this framework, but I just want to bring it up again today to sort of paint the full picture of all these different systems involved in balance. So when we think about balance, we want to think about stability when walking. We want to think about the body's response to or reaction to an expected perturbation or loss of balance. So if you were going to reach up into your cabinet, had to lean way far forward, you're expecting to come out of your you're expecting your center of mass to go beyond your base of support a little. We also need to be able to handle unexpected reactions. So if you're walking your dog and the dog suddenly leans in to go chase a squirrel, you are not expecting that, and we want to be able to respond appropriately. Strength and flexibility are a very important part of maintaining balance, and our standing stability and posture, so standing in place. And then of course the sensory system that I mentioned before is an important role in balance. Our vision, our inner ear, and then the sensation and proprioception, or sense of where we are in space, are all critical in balance. And again, it's all these different complex interactions. It does give us a lot of opportunity of different ways to target balance. And it's important to also note that some of these are more impacted by Parkinson's than others. So again, we can target different systems based on their ability to change and what's specific to the person, what specifically the person has difficulty with. So I'm going to present on the next several slides several balance treatment programs. So we'll start with strength training. Strength training is important in any balance program. So not only are the benefits related to improved strength leading to easier day-to-day mobility, such as standing up from chairs, getting in and out of a car, and just walking. So strength is important for those things, for you to maintain your balance during dynamic tasks like that. But a really critical thing too with strength training and balance is strength training improves the efficiency and speed of your muscles when you need them. When you need them to turn on, strength training can help them work better. So that I mentioned before, you're walking your dog and it sees a squirrel and it lurches forward. We want to be able to have a quick, efficient response to that with our muscles. So strength training can help with that. And this is something this sort of change in way our muscles react due to bradykinesia and rigidity, it's something that we find even early on with Parkinson's. So you may not notice a balance problem per se yet, but sometimes these changes are already occurring. So it's an excellent opportunity to get ahead of any balance problems by starting strengthening early or starting it wherever you are in the disease process. You can always benefit. Another well-established treatment for balance is actually Tai Chi and dance, specifically tango has been studied. And it makes sense because these two activities involve complex movements, moving around your base of support. It has a complexity and a sort of that mind-body connection that can really help with balance problems. And the other factor is these are often fun, and particularly with dance with a partner, they can be much more engaging than other forms of exercise that we would think of as less engaging, less what someone might want to do. So we always say that the best exercise is the one you'll do, and these Tai Chi has been well studied and has led to decreased falls and in Parkinson's and improved balance. So if you can find a way to get involved in either Tai Chi or dance, this is an excellent way to target many of those systems that can lead to difficulty with balance. Agility training. So you can see from these pictures, agility training involves sort of, again, complex movements, weight shifting, sometimes quick movements, quick directional changes, sort of more challenging movements such as standing on one leg and throwing a ball you see the gentleman doing. So again, really, these exercises are requiring a lot of focus. They're requiring you to maintain balance while focusing on something else. So doing two things at once, essentially. And then also working on the speed of movements, the speed of the response of your movements. And you can see that woman doing the ladder stepping, shuffling there. So these are often treatments that are best done in a physical therapy clinic or supervised in from an exercise professional. And this is because in order to get really good benefit from these, they should be challenging. You do need that just right challenge. And you also need, when you reach the challenge, when you achieve an improvement, you need to be challenged at the next level. So you need, even within a session, you might be leveled up and have it made more challenging for you. These can be a little more difficult at home just because of safety, but they lead to excellent benefits. So another balance treatment that we talk about is dual task training. And sometimes difficulty with dual task can be one of the earliest things that people will notice a change in their balance with Parkinson's. And this is because as motor tasks become more complex or require more attention, you might notice that it's a little bit more difficult to focus on both the motor task and the cognitive task. So for example, someone who's walking through the mall and they're late for dinner and their cell phone rings. That might be a situation where so much information is coming in that the person has difficulty focusing on the motor task of walking and may notice a change to their balance. And this is thought to be an issue in Parkinson's with prioritization. So rather than prioritize the task of walking and staying upright, the person's then thinking about, oh no, who's calling me on my cell phone telling me I'm late for my dinner reservation? So this, for a long time, this was addressed through compensation. So rather than try to make it better and make someone more able to focus on those two things at once, we used to recommend to the patient, oh, okay, just turn off your cell phone, leave 30 minutes ahead of time so you're not late for the dinner reservation, which are good strategies as well. But now we have evidence that we can actually train this to go better. So through both task training, so practicing walking, and layering on cognitive tasks, so math, doing subtraction in your head, or verbal fluency tasks. So that would be something like name all the countries that you can that start with the letter C. So practicing this while practicing walking and maintaining high quality walking. So larger steps, better speed. So working together on these two things can lead to improvement and decrease fall risk. And then the sensory system is another one. So I'm pulling this out separately to discuss, but this could also be incorporated into several of the other treatments that I mentioned. For example, for strengthening, you could stand on a piece of foam to do squats versus doing them on the floor. Or you could practice in the agility section. A therapist might say, why don't we try to do this task with your eyes closed? And so that would also help enhance other systems. But the sensory systems are important to address because with Parkinson's, people do tend to rely heavily on their visual system. And so this is a really great area that we can target to make sure that all of our sensory systems are as optimal as they can be. And you can see in the picture, other ways to do this are to walk on different surfaces, walk on more uneven surfaces rather than just flat pavement. So walking through the park on the grass, walking on sand if that's available to you. So these are all ways to possibly challenge your balance system. And then walking and gait training. And this is critical, and I left it for our last slide of talking about intervention because all the other things that I've talked about do play into walking as well. So our sensory system, our strengths, but just the mere practice of walking is critical to improve your balance. So as people may have noticed, Parkinson's can impact your walking with smaller steps, slower steps, an impact on your posture, leaning forward. And just by walking with the intent to improve some of those characteristics, so really focusing on standing upright, taking larger steps, and then trying to take faster steps, those three changes in and of themselves can improve your balance. Walking also increases your muscle strength in your legs, so an important factor for maintaining balance. All right. So how much is enough? How much balance training within these different interventions should you be doing? So we would recommend, and the evidence supports, doing these activities 2 to 3 times a week and acknowledging that intensity matters. So you don't have to do it for a long time. So probably 30 minutes, 2 to 3 times a week would be a great goal, but you want to make it challenging while you're doing it. So this, if it's, it needs to push a little bit your stability limits in order for you to benefit from it. So again, this is why you really have to consider safety and where you're able to do these balance exercises, probably ideally in the setting with some supervision from a physical therapist or an exercise professional. This also enables you to have progressive challenge. So you don't want to, just like other exercises we talk about, you don't want to stay at the same level. You want to continue to challenge yourself, and it helps to have a very individualized program and some supervision to help continue challenging yourself. When should we treat balance? So as I mentioned, we've discovered that there are early changes to the way the muscles respond, and they become, because of the bradykinesia or the slowness and the rigidity, we have a little bit slower turning on of the muscles, and that can happen even very early on in the disease process. So the answer is we should always be treating balance. We should be assessing balance from a physical therapist throughout the disease and intervening in those different domains depending on which areas need help. So it's never too late to start addressing balance. You can have a good effect at different stages of the disease. The treatment might look a little bit different, but there's always room to improve strength, cardiovascular endurance, and overall balance. And in summary, what I'd like to, the take-home messages here to be, so one thing I didn't talk much about is medications, but it is important, and Teresa talked about this in her talk, the medications do have some impact on some features of balance, but not all. But before you were to start a balance program, it's always a good idea to make sure your medicines are optimized, that your bradykinesia and your rigidity is being well managed. And overall, this is always the approach that is recommended for Parkinson's, you know, between optimizing medications and overall exercise, physical activity plan, and that's where you're going to get your best outcomes. And balance is no different. So balance is complex, as I hope I have relayed. So an individualized program is best. So this balance is harder to just go online and sort of get a program for an older adult or a person with Parkinson's, or, you know, any sort of program that you can find online. It really needs to be tailored to your specific needs. And to figure out how to do that, Teresa's lecture, the number 2 in our series, does a nice job of explaining what a physical therapist is looking for when they're trying to create that individualized program. So start today. You could start with a strength training and walking program to start right now improving your balance, but always play it safe. So when you're looking for more of that agility and some of those higher level, more challenging tasks, you would probably want to get some help with that. Starting balance training early at the beginning of a diagnosis. I saw in the chat there are a few people who have been recently diagnosed. So starting balance training now, it would be great. But doing it anytime will benefit you. It's never too late. And in relation to that, you don't need to wait to have a balance problem or have a fall to start working on it. In fact, it's ideal to begin addressing your balance before it's a problem. And that's how we stave off and push off disability and falls with Parkinson's, is to do the work before it's a problem. All right, so in a minute, I'm gonna have Tim Nordahl join me to help with the Q&A. I see some questions coming up as I've been talking, and we'd love to get to those. Continue to enter them if you think of another question while Tim and I are talking. And while we're waiting for him to join us, I just want to share this. I made several references to this, but we are here to help you. So if today we don't get to your question, or if it looks like a question that might be beneficial for us to talk with you directly about, please call us at 888-606-1688 or email us at rehab@bu.edu. And we would love to talk with you about any question you have regarding balance. And we can also share with you other resources, both through the APDA and even some exercise resources if you're looking for some things online. So that is a great number to write down. And Tim has joined. Welcome, Tim.
Hi, Tammy. How are you? This was great. Thank you so much.
Thank you. All right.
So I was keeping an eye on the Q&A while you went through the presentation, and there were a lot of fantastic questions coming in. Definitely keep them coming as we go through. So we'll keep watching them as we answer the first few questions that came in. I think one of the first easiest questions was someone had mentioned they missed the first 2 seminars. And I wanted to make sure that you saw we had added the link to the first 2 seminars in this series on balance. So that is in the chat section, but maybe we can repost one more time just so to make it easy to find. And the session from today will also be posted online after. First question we got was about the connection between your brain and your feet. And sort of, they had heard that your feet are really important for your balance. And they wanted to know a little bit about what the pros and cons of going barefoot would be for Parkinson's disease.
Yes, yes. So this is a question we got beforehand. I remember reading this. So it's a really good question. And I know there are some different programs out there that will recommend barefoot walking, and there's this whole movement for barefoot running to feel. So I think it depends, like everything else, but the one concern I would have with barefoot is obviously not protecting the skin on your feet. And there are older adults in particular might have some issues with neuropathy or changes to the sensation of their feet. But otherwise, yeah, I think in a controlled environment, doing some of these exercises barefoot, particularly some of those agility ones I had mentioned, it's not a bad idea to kind of enhance the program. Try them with shoes on, try them barefoot. But yeah, in a safe environment, I think there is some benefit to being barefoot, because the thick-soled shoe does interfere with some of the input and information you get from the earth or the ground. Yeah, so with the caveat that it might not be safe for everyone due to sensory issues.
Yeah, yeah. And then another question we got was, is sitting on a stability ball a good way for helping to develop your balance?
Oh, yeah, so it certainly targets a different type of balance. So you'd be more working on your core strength or your core balance. But yeah, that is definitely a way to target that. It's seen on the front of our Be Active booklet on this slide right here. And so it's a way a lot of exercise professionals or fitness professionals and physical therapists will use it as a way to add a little bit of balance challenge or core activation for while doing other activities. So actually that's a perfect example of that, of doing an arm exercise, a trunk exercise to strengthen your lats, which is a back stabilizer, but sitting on the ball just to add a little bit extra element of challenge to it.
Yeah, yeah. You always want to make sure like you're working on your feet too, so you don't want to only sit on the ball, but it's a good way of working that in.
Yes.
A couple of people have asked, and I think this is a really great question. I know we hit on it a little bit, but just kind of what are the best ways to work on your balance if you might have mid to later stages of Parkinson's disease?
Yeah, so I think going with the idea of starting with strength training, strength training and walking, I think would be the best, but I think it's important in the mid and later stages because there are other factors that can then impact balance. So your ability to dual task or focus on walking and, having divided attention, that can sometimes for some people be harder in the later stages of Parkinson's. So this is when it would be critical to have an assessment from a physical therapist to kind of see where your time would be best spent in terms of balance, identifying which of those systems needs the most work. But having said that, if just to start right now, I would say walking and working on some of those gait parameters or walking parameters, like the length of your steps, and working on strengthening your legs. Those all, as we sort of call that low-hanging fruit, like that's a great place to start in mid stages of Parkinson's.
Yeah, I think it's great to have an individual assessment in those later stages, because there's a lot that can be done, but it's just oftentimes good to have an individualized program at that point.
Right. Well, as we know, and I'm sure everyone listening knows, everyone with Parkinson's, very different. There's certainly commonalities, but people present so differently. And as complex as Parkinson's is, so is balance. So that individualized program really is important.
Right. And so I think on the other end of things, someone else had asked that, I've had Parkinson's for about 10 years so far. They've had no trouble with their balance. And she asked, can I assume that that's an indication for the future too? So I think she's asking just a little bit more about sort of, what can you expect if you've gone 10 years without trouble with your balance?
Oh yeah, it's a good question, and I think it goes back to that's great. Like, I'm glad that there's no trouble with balance, but it is safe to assume that as we get older, we all have changes that impact balance. So whether you're 40 with or without Parkinson's, there are changes as we age that will make balance more difficult. So I think it's important to early on start addressing some of those things that are possibly changes. So I talked a bit about the muscles. So making sure that your muscles are strong and can have a good, efficient and timely reaction when we need them. It does happen too with Parkinson's, and we've studied this, that people with Parkinson's as compared to older adults tend to actually do less things and walk less and move less and engage in the community less. And I don't know if this applies to the person asking the question, but we do want to consider, have you changed your lifestyle so that you're not in situations where your balance would be challenged, or have you kept up what you're doing with no balance problems? So it's important to look and make sure you're not modifying to your activity levels to accommodate these subtle changes that can occur.
Right. And then another person had asked, I have ongoing moderate to severe lower back pain. Are there any specific exercises for them, because it's hard for them to stand for any appreciable amount of time?
Yeah, so I might lob that right back to you,
Yeah.
because Tim is our back expert.
So there are a lot of conditions that could be going on there, and I really think that I would want to steer you towards asking a physical therapist about this. Oftentimes there are ways that we can help. I saw another person that actually asked specifically about Parkinson and lower back pain. These things are definitely closely related, and it could easily warrant a whole other presentation. So it's definitely worth it working on that if you have that problem, because I think that can cause issues with your activity level and with your balance. So I'm really glad you brought it up. There's oftentimes a lot that we can do for it, and it'd be great to have you ask a physical therapist. If you need help finding someone, feel free to reach out to us on the contact information that's listed on the screen there. And I think, let's see, one other person, and I think this might have to be the last question we have time to get to, was just asking if you could elaborate on the optimal medication and medication and exercise balance.
Yeah, it's a good question. So when I say optimal, I just mean that your symptoms are well managed and well treated, which is is a challenge of Parkinson's, right? But before entering into a balance program, let's say with a physical therapist, it wouldn't be a bad idea to check with your neurologist and just make sure that your symptoms are as well managed as possible. Particularly, we talk about the bradykinesia and rigidity, because those are the symptoms that are modifiable with medication, that respond well to medication, and those two symptoms do impact balance. So just I don't have any specific suggestions. It's just more optimization, seeing your neurologist, making sure that the timing of the meds and the everything's working as best that it can.
Yeah.
So I just, before we finish, Tim, I want to pass along information. There's an optimism walk October 17th, and the link to register is posted in the chat, and I'm sure you could also find that on the APDA website. And lastly, I want to thank you, and Teresa is here for the series that you guys have done. And I also want to just share, if the listeners out there have enjoyed and appreciated this, if you would ever consider a donation, that can also be done through the APDA website, so that the APDA can continue to bring you programs like this. So thank you so much, everyone. Thank you, Tim.
Oh, thanks, Timmy. This was great.
Okay, stay well, everyone. Bye.